Welcome to Resident Rights. I'm Chris Model. I will be your narrator. Today we are going to cover the following areas: privacy and confidentiality, dignity and respect, abuse, neglect, exploitation and misappropriation of property, as well as reporting requirements. But first we need to talk about compliance. The Office of Inspection General, or the OIG, requires all businesses who receive any federal funding to abide by laws and regulations. Facilities need to have a compliance program, of which we do. Employees have the responsibility of reporting. Employees must know how to report, and we must have a compliance manual. You'll find the compliance manual located in the administrator's office. All residents have rights. These rights have been afforded to them by federal and state laws. Residents must be informed of their rights prior to or at the time of admission. As employees, we must ensure residents can exercise their rights without fear of interference, coercion, or discrimination. As employees, we must understand resident rights so we can make sure that they are not violated. So let's get started with privacy and confidentiality. Residents have the protection of making sure that their information is kept private. That is our responsibility. We, as employees, must not be overheard. We need to be aware of where we are at all times and what kind of information are we making or stating. So be aware of your surroundings. Do not release the medical record without permission. Not discussing resident information with other people, such as family members or visitors, etc. Making sure that we pull privacy curtains or window treatment so when we're performing our cares. And asking visitors to step out of the room while care is being delivered. Never discuss resident information in hallways, dining rooms, as you never know who might be listening. Never assume that all residents are hard of hearing. Never assume that a cognitively impaired resident doesn't understand. And keep CNA assignment sheets or their plans of care in a safe location. Knock before entering a resident's room. Announce yourself. State your purpose as to why you're there. Do not post care-related information, but can we ever? And the answer is yes, as long as we have obtained the proper permission from the resident or their legal representative and we have it care planned. So for example, we may have a sign that's posted on a resident's walker stating to remember to lock the brakes to the walker. And so that is identifying that the resident is potentially forgetful. As long as we have the resident or the legal representative's permission to post that sign and then we have it care planned, we are able to post that information. We also need to make sure we're delivering mail and newspapers timely. Only opening up the mail when a resident requests that of us. Affording a resident privacy when they're making a phone call. And making sure that we're keeping catheter bags covered at all times, whether the resident is in their room or outside of their room. The resident has a right to choose their physician. They have the right to review their medical record and to even know their medical condition and know their medical condition in the terms that they understand. They have a right to participate in their care plan and even to accept or to refuse treatments. They also have the right to self-medicate. We need to make sure that we avoid certain administration of treatments in areas that are considered public areas. So testing a resident's blood sugar, injecting them with an insulin injection, conducting blood pressure checks, or instilling eye drops, checking their pulse, or maybe even doing a simple dressing change. Those are things that need to be conducted in the privacy of the resident's room or in a very private location where viewers of the public cannot see what is going on. At this time, If you have any questions regarding privacy and confidentiality, I would suggest that you jot them down and bring them to your supervisor's attention so that we can get those answered for you. The next area that we are going to cover is with dignity and with respect. And if you take just a moment and kind of think to yourself, how would I indeed promote dignity and how would I promote respect? These are good reflection types of questions that you would want to ask yourself, what would I want? Because what you would want is most likely what should be being delivered to the patient or our residents. So with dignity and with respect, we need to make sure that we're speaking to our residents with respect. We need to be kind, we need to be helpful, and we need to be polite. We need to use good communication skills. We need to establish eye contact, being timely when we're returning phone calls, etc. Again, another time right now for you to reflect on what does good communication look like to you. The resident has a right for self-determination, which is the ability to make decisions and choices for oneself. They can choose their schedule, including what time to go to bed and what time to wake up. They can choose activities, whether they are internal, such as inside the building or outside of the building. Not everybody likes to play bingo, so we have to be respectful of their right to choose to participate or not. Choices of regarding aspect of their life that are important to them. Choices of what to eat, when to eat. Choices of what to wear. Choices of personal possessions, such as, do they want to have money on hand? When we look at having residents' monies on hand, we certainly can encourage them to have the money available, but letting it be protected by the facility. So they still have the right to control their own money, but yet we're affording them some safekeeping options. They have the availability of their money 24 hours a day in the skilled nursing facility settings. They can open and establish what we call a trust account, whether that be in the assisted livings or the skilled nursing facilities. So when you get back to your facilities, I'd encourage you to find out about the trust account and how that is managed. Other examples of dignity and respect would be such things as rinsing urinals after use, keeping urinals away from water glasses, meal trays, dentures, denture cups, moving residents in a forward direction, never dragging or pulling them backwards, keeping their hair clean and combed, applying makeup as they desire. Shaving versus unshaven, making sure that the men that grow facial hair, is that their choice? Do they like to be clean shaven or do they prefer to have facial hair? Making sure that we have radio stations and TV programs that are on per resident choice, not what the staff want to listen to while they're providing care. Avoiding addressing residents by calling them honey, darling, sweetheart, etc. Making sure residents are clean, that their glasses and hearing aids are applied, and that those too are clean and in good repair. Making sure that the wheelchair is clean and in good repair. Treat each resident as an individual. Avoid referencing them by a room number or a diagnosis. They have the right to have visitors with people that they choose to be with. They can have these visitors after hours. Please make sure to check with your supervisor to determine your facility's procedure. All of the facilities have a doorbell because the doors do lock at a certain time in the evening, and if access is needed, visitors will have to use the doorbell to gain that access. Residents also have the right to practice a religion of their choice. They have the right to know about the choice they have about the care they receive. They have the right to know about their condition and in those words that they understand. So again, we need to make sure that we're using words that they understand versus using medical jargons. They have the right to be told about side effects of a medication. They also have the right to own their own personal property and to have that along with them as long as it does not interfere with their safety or the safety of others. They're able to use their own electrical devices such as a TV, computer, or radio, but those devices need to be checked for safety before use. There are some restrictions, though, on items that they may want to bring in from home, such as anything that produces heat, curling iron, heating pads, electric blankets, coffee makers, etc. So please make sure that you check with your supervisor to make sure what product or items they can bring in that are safe for use. Never rummage through resident belongings. A resident has the right to have their personal property protected. But can we ever search through resident belongings? And the answer is yes. Not because we think that it looks pretty cool and we want to be snoopy and look into what they have, but it's because it possibly is posing a safety risk to them, to the resident, or to maybe other residents. So, for example, if you have a resident that is an active smoker and they have decided to light a cigarette after they had their supper meal, they went back to their room, they lit a cigarette and began smoking in their room. As we all know, smoking is prohibited from being done inside the building. It has to be conducted off or out of the building, and in most cases off of the campus. And so we would have a right to search that person's belongings for cigarettes as well as any lighting materials. But you always want to make sure that you're conducting that under the direction of either the social worker, the administrator, or the director of nursing, and making sure that we have two people at all times when doing a search, because we never want to be put in a situation where it's a he said, she said. So for example, Mrs. Jones says that she had a $50 bill in her wallet, but since Billy, the CNA, searched her belongings, that $50 is now missing. Billy wants to be able to protect himself by having a second colleague or coworker with him to make sure that nothing was stolen. Residents also have the right to share rooms with their spouse or their same-sex partner. They each, though, must sign a consent to the arrangement if they're members of the opposite sex, just to make sure that they're comfortable with this. They also have choices, again, about their bath. Do they prefer a bath or do they prefer a shower? The frequency of their baths, food preferences, meal times, their therapy schedule, just overall decision makings, medication times, as well as doctor choice, as we already have discussed. So is this anyone that we know? Honey, I've been through 2 world wars, the Great Depression, taught 13,297 children, administered 4 elementary schools, and outlived every one of the pastors that I worked with. I'm 98 years old, and you're telling me it's bedtime? Again, at this point, if you have any dignity or respect questions, I would suggest that you again jot them down and then address them with your supervisor so we can get you the answer that you're looking for. We are now moving into the section called Abuse, Neglect, Exploitation, and Misappropriation. An overview of the abuse regulation. Residents have the right to be free from abuse, neglect, misappropriation, and exploitation. We cannot employ individuals who have been found guilty of abuse or have an abuse violation against their professional license. We must have policies and procedures and educate our staff about residents' freedom from and how to prevent abuse. Staff must be able to identify potential abuse and know what to do to protect residents. Staff must know how and when to report suspected abuse. Staff must know how to investigate incidents. So our policy describes how we will prohibit and prevent abuse, investigate allegations, train our staff about abuse, and that has to be done annually, report crimes as required by state law, annually notify individuals about following reporting requirements, and participate in annual training as required. So let's look at abuse. Let's look at that definition. Abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment, with resulting physical harm, pain, or mental anguish. It includes withholding goods or services that are necessary to attain or maintain physical, mental, and psychosocial well-being. It includes verbal, sexual, physical, and mental abuses caused through the use of technology. Instances of abuse of all residents, irrespective of any mental or physical condition, cause of physical harm, pain, or mental anguish. Willful is defined as the individual acted deliberately, not that the individual must have intended to inflict harm or injury. Exploitation means taking advantage of a resident for personal gain through the use of manipulation, intimidation, threats, or coercion. There are two types of exploitation. There can be financial and sexual. Financial of a resident occurs when a person steals, withholds, or otherwise misuses residents' money, property, or valuables for personal advantage or profit. Sexual exploitation is the sexual abuse of someone through the exchange of sex or sexual acts for drugs, food, shelter, protection, or other basics of life and/or money. Financial exploitation is the most common form of elder abuse. Losses are huge. In a study that was conducted in 2010, there was an estimated that our older Americans lost at least $2.9 billion to financial exploitation. And that is just an estimate, as there's many cases of financial exploitation that go underreported. There's other forms of exploitation that are considered financial. They're considered also consumer scams, where there might be a relative in need, where maybe a long-lost grandson allegedly calls grandma and saying, "Grandma, I want to come and visit you, but you need to wire me money." And the grandmother wires money, but it's not to her grandson, it's to a scam artist. There might be charity appeals or lottery or sweepstakes. Could be that someone reaches out to an elderly person, says that they've won a sweepstake, but in order to claim their prize, they have to send $30 in Walmart gift cards to a certain address. Or it could also be home improvement scams, where there might be a damaged city due to a hurricane, for example, and a scam artist goes into that community, claims that they will repair the roof and other damaged parts of the house, but they have to pay up front in order for the services to begin. And then when the payment is made up front, the scammer runs off with the money and doesn't complete any of the repair work. There's also involuntary seclusion, which is separation of a resident from other residents. It could be from his or her room. It could be confinement to his or her room, or it could be against the resident's will or the will of the resident representative. There's misappropriation, which is defined as the deliberate misplacement or exploitation or wrongful temporary or permanent use of a resident's belongings or money without the resident's consent. There could be false representation, making a promise without the intent to deliver. So if a resident read the coupon or the sales that are going on in the community at the local grocery store, sees that there's Diet Coke that's on sale, says to one of the nursing assistants, "If I give you $20, would you be willing to go pick me up the Diet Coke?" And the CNA agrees to it, takes the $20, but puts the money in for gas and neglects to pick up the Diet Coke for the resident. Could be using resident identification, where they open up credit cards in mom or dad's name and rack up lots of charges because they had access to the residents. This could be a son or daughter, for example, that did this, and they charge up a lot of credit, and the parent never gave them permission to do so. It could be theft of money, credit cards, jewelry, clothing, or other belongings. There's also neglect, and neglect is the failure of the facility, its employees or service providers to provide goods and services to a resident that are necessary to avoid physical harm, pain, mental anguish, or emotional distress. It could be intentional carelessness, negligence, or disregard of policy or care plan, which causes or could be reasonably expected to cause pain, injury, or death. So the thing that I just want to make sure that I'm stressing here is the importance of making sure that you are following the resident's care plan, because any deviation from that could fall under the umbrella of neglect. Here's an example of neglect, that a staff person who sees the call light is on but assumes that the coworker has answered it. The person is wrong and the resident is now incontinent. Our goal as a company is to make sure we're addressing call lights within 5 minutes. That's our goal. And also, everyone is responsible for answering call lights. Not everyone is responsible for answering the need of the patient, however. So for example, by trade, I'm a social worker, so if a resident needed to go to the bathroom, I am not trained to safely transfer them from their wheelchair to the toilet. However, I can answer that call light, find out what they need, and if they need to use the bathroom, I can go find them assistance. Or if they have their call light on and they need to, if they have a need, and all they need is to know what time bingo is, I certainly can look up that information and provide that to them. Other examples of neglect include acts of retaliation. A caregiver leaving a resident outside for approximately 2 hours without sunscreen. The resident suffers first and second degree burns. Not using a gait belt when required. Not giving a resident food or physical care that they need. Leaving a resident wet or soiled. Failure to deliver or administer medication. Turning off a call light with no intent to meet the resident's need. Failure to follow the care plan is another form of neglect. Transferring a resident with 1 assist when the care plan says 2. Transferring a resident with 2 when the care plan says to use a mechanical lift and 2 assist. Please make sure that you read your CNA assignment sheets or your care plans before the start of each shift. Residents' conditions change, and you need to always be on top of where that resident is at with their given need at any given time. There's also the form of injuries of unknown source, and that is a resident that has an injury that is not the result of a known accident or event. So again, injury of unknown source is a resident injury that is not the result of a known accident or event. 2 conditions that need to be met. The source of the injury was not observed by any person or could not be explained by the resident, and the injury is now suspicious because of the extent of the injury, its location, the amount of the injuries at one particular point in time, or even over time. We screen employees. The facility cannot employ or contract with anyone who has been found guilty of abuse, neglect, exploitation, misappropriation, or mistreatment. They have a finding that's been entered into the State Nurse Aid Registry concerning the above. They have a disciplinary action in effect against their professional license of finding of the above. There are different types of abuse. There's physical, sexual, emotional, financial exploitation, neglect, self-neglect, abandonment, domestic, etc. Again, here's some time for you to reflect upon what are some examples of physical abuse? What are some examples of verbal abuse, mental abuse, or even sexual abuse? Abuses, they can be hands-off offenses or they can be hands-on offenses. Hands-off offenses such as exhibiting naked body parts for sexual gratification or exhibitionism, observing other people or things for sexual gratification such as someone's underwear. This is called voyeurism. Forcing an individual to view pornographic material. Harassing or threatening in a sexual manner. Hands-on offenses would be things such as kissing or touching a resident's breast, genitals, body, or their buttocks, or it could be penetration of the resident's mouth, vagina, or anus. There's two types of predators. There's power predators and persuasion predators. A power predator is one that we fear as we walk down the street. They're the ones that break into our homes or jump out from the bushes. Persuasion predators are ones that are quite manipulative, tend to be friendly, and not obvious. Power predators attack and strike when they feel that they will likely prevail. Their acts are violent and coercive from the start. They rarely work in long-term care settings. The persuasion predators start in a manipulative but friendly way. They're a crime of privacy and opportunity. They circle and approach the victim slowly and watch to see how they react to advances. They test the waters, which is also called grooming. They're likely to seek work with vulnerable people, unlikely to target other employees. So the grooming, and what I mean by that is that it is a term or process because it can be confusing in long-term care settings because we use grooming. We brush people's hair, we comb their teeth, we get them dressed. That's considered grooming. But in this setting, its lack of grooming or provision of care can be neglect or abuse. In cases of sexual abuse, the behavior is ascribed to a process called grooming. It describes a process of building trust, bestowing favors, alienating others, violating boundaries, building allegiances in order to achieve their desired results. Indicators of grooming behavior could be you have a coworker that shows special interest to a resident, or you have a visitor that comes in and gives many gifts and treats and favors to a particular resident. Someone using massage or sensual touch during cares, providing personal cares while alone. And I don't mean, that Millie, Mrs. Jones, is a one-person assist, so this person is in there, thus we have to be concerned about them grooming this person. That's not what I'm talking about. I'm talking about when they're using that alone time and always maybe wanting to be the one that provides the personal care to their advantage. Signs of abuse of a victim: there could be sleep problems, behavioral changes. Resident could have episodes of now tearfulness and crying. They could have a decreased appetite. They are now withdrawn from activities that they once found interest in. They have blood in their urine or stool. They have difficulty walking or sitting. They may complain of stomach pains, digestive problems. They may have unexplained genital scratches, bruises, or contusions. They may have injuries that are not consistent with the explanation that was provided. We screen all of our employees and all of our residents, and we screen them to make sure that, for our residents, for example, that they're not a sexual predator. I'm about to show you some physical abuse neglect photos. And the disclaimer that I'd like to read is that the following photos are examples of abuse incidents that have been reported to elder abuse agencies. The circumstances surrounding the abuse are not known. And this picture is not the best. However, you can kind of see that it looks like an outline of a belt. And I'm assuming that it's an outline of maybe a gate belt that was used in being abusive to a resident or to a person. This particular gentleman has bruising in some very unique areas of his body. Over his left nipple area, you can see over the right side of his lateral side of his body. This is the same picture of same gentleman, just a different photo of his what looks to be like his right shoulder, and some pretty significant marks which have not been identified. So I have no idea what caused this, but this looks suspicious. This particular person has a number of bed sores from in this case, it's because of neglect, lack of repositioning, etc. This particular person may be a pretty common condition that we see. In this particular case, it was considered abuse. They've identified that. But we do have a number of residents that have very, very fragile skin, and they bruise very easily. And it is not abuse. But in this particular case, they did identify it as abuse. This particular person has a pretty significant contracture to their left hand. They have some fungus on their nails. They have unkept nails. They have yeast infection, which is the white patchiness that you see on the skin. Another form of physical abuse is considered physical restraints. And all residents have the right to be free from any type of physical restraint. And a physical restraint is defined as any device, material, or equipment that is attached to or near a person's body which cannot be controlled or easily removed by the person. Deliberately prevents that person or is deliberately intended to prevent a person's free body movement. It's intended to prevent a person's free body movement to a position of their choice and or a person's normal access to their body. Physical restraints can include vest restraints, straps or belts, wheelchair brakes, chairs that tip backwards, tucking in bed sheets too tightly, or even bed rails, or commonly known as side rails. Another form of abuse is chemical restraints. It's a psychotropic medication that's used for discipline or convenience and is not required to treat medical symptoms. A medication given primarily to control a person's behavior and not to treat a mental illness or a physical condition. Chemical restraints can include medications in the classification of anti-anxiety meds, hypnotics or medications that make you sleep, antidepressants or antipsychotics. There's also violations with the use of social media, using handheld wireless devices, photographic or comparable equipment to capture or transmit images of residents. Unless you're authorized, cell phones cannot be kept on your person and can only be used during break times. Again, cell phones cannot be kept on your person during your time you're working. They can only be used during break times. You are to keep your phone in your locker, in your purse, your car. They cannot be on your person at any given time during the course of your work, except for use during a break time.
Since 2009, the Office of Caregiver Quality within the Division of Quality Assurance has seen an increase in the number of caregiver misconduct reports related to handheld devices. The number of misconduct allegations related to handheld devices reported in 2016 is almost 6 times greater than it was in 2012. This increasing trend has resulted in 8 additional cases reported every year since 2012. 40% of those cases reported have occurred in nursing homes. The applications most commonly used in incidents of alleged misconduct using handheld devices include Facebook, Snapchat, and text messages. Many handheld devices are now multimedia capable and allow users to save, send, and post photos or videos instantly. While this may seem like an innocent act, it can lead to caregiver misconduct. Using these applications to take photos of residents may violate rights that are in place to protect their privacy, identity, and personal information. Even the slightest portion of a resident's body revealed through a photo or video could be considered a violation of resident rights and the Health Insurance Portability and Accountability Act, also known as HIPAA. The video you just watched was one example of the consequences of handheld device misconduct in the workplace. Pictures taken of residents using applications such as Snapchat violate resident rights and can lead to a finding of misconduct on the Wisconsin Caregiver Misconduct Registry. The caregiver, Kara, envisioned the consequences she could have faced by using her phone to share a photo of a resident. She first saw herself put on suspension for violating a resident's right to privacy and not complying with the facility's policy for phone use in the workplace. She then envisioned receiving a phone call from an Office of Caregiver Quality investigator regarding the allegation. Finally, she imagined receiving a letter regarding a finding placed in her name on the Wisconsin Caregiver Misconduct Registry. A person whose name is listed on the Wisconsin Caregiver Misconduct Registry is not allowed to work as a caregiver in any Department of Health Services regulated healthcare facility in Wisconsin, cannot operate a licensed entity, and cannot live in a licensed entity unless the person is approved through Department of Health Services Rehabilitation Review. An approval through the rehabilitation review process is an opportunity for a caregiver to provide clear evidence that the conduct that led to their finding is not likely to reoccur, and that residents will remain safe under their care. Before taking a photo or video in the workplace, consider the policies in place and the consequences for not complying with them. By sending or even taking a photo or video, you are putting your job and future career as a caregiver at risk. The Division of Quality Assurance is confident that awareness of this issue will reduce the potential for caregiver misconduct and violation of resident rights in Wisconsin's healthcare facilities. Thank you for taking the time to watch this video.
So again, examples of caregiver misconduct include posting a photo, video to social media, such as Facebook, Twitter, Instagram, having an image or video of a resident on your camera or social media sites without their written consent. If you witness or are informed of abuse, your first thing that you must do is stop and protect the resident, intervene, and stop that abuse from occurring. You are to report all alleged abuse, neglect, exploitation, mistreatment, injuries of unknown source, and misappropriate resident property immediately to your administrator, designee, and state agency. We have within 2 hours and within 24-hour time frames for reporting. Suspicion of a crime must be reported to law enforcement officials against any resident. No later than 2 hours after forming the suspicion that there's serious bodily injury to the resident, and no later than 24 hours after forming the suspicion that there's no serious bodily injury to the resident. So for example, if we discovered that a resident was punched in the face by a caregiver, and now that resident has a broken nose, swollen eye, and bruising to the cheekbone. That is considered serious bodily injury. It is an assault of that particular resident. It is a crime, whether you're in the building facility or outside the facility. That would need to be reported within 2 hours to law enforcement. Any person may express concerns or inquire about suspected resident mistreatment. We cannot retaliate against any employee, resident representative, or other interested person who is acting in the best interest of the resident. We are obligated to protect the resident from further abuse while the investigation is being completed. This may include suspending the staff person. Does not mean that the staff person is guilty of anything, but it's just that we're protecting not only the staff person but the resident during the course of the investigation. It may involve us reassigning a staff person to work in other areas of the facility during the course of that investigation. The results of the investigation must be reported to the administrator, other officials according to state law, including the Department of Quality Assurance within 5 working days of that incident. Our role and responsibilities of employees include that we're all required to follow the nursing home regulations. We're required to identify and to report suspected crimes towards residents and alleged abuse, neglect, misappropriation, exploitation, and involuntary seclusion. We must understand the definitions of abuse-related events that are reportable. We must know our facility's reporting policy and follow it. Oftentimes, we may come across where residents are inappropriate, and what do we do about those situations? Often, inappropriate resident behavior is due to the resident having a cognitive issue such as dementia. This decline interferes with memory and with judgment. It may be a result a resident may not understand that their actions are inappropriate. They have decreased inhibitions, or they have trouble controlling their impulses. Our caregiving duties often require us to work in close physical contact with residents. This increases the potential for misunderstandings or unwelcomed incidents. Aggressive and inappropriate comments or actions, such as lewd jokes, flirtatiousness, hugging, kissing, touching, grabbing at breasts and genitals may occur. When this happens, employee responsibilities or actions would include clearly and calmly state to the resident, "Please stop. This is inappropriate." Keep your conversation to a minimum and direct it to the task at hand, and avoid any kind of chit-chat. Distract the resident's attention. Avoid appearing shocked or even flattered. Set boundaries. You may need to assist with cares. You may need male staff to work with male residents versus female caregivers. Maintain the resident's dignity, and please make sure that you report inappropriate behaviors to your supervisor so that we can develop care plans and we can also provide ongoing education to the caregivers. Another form of abuse is considered resident-to-resident altercation, which is any physical or verbal contact or exchanges between residents needs to be reported. Injury or no injury, this also must be reported. Whether it's willful or not willful, this too must be reported. We need to interview residents immediately after the altercation to help determine their understanding of the event. We also need to separate the residents. We need to provide a safe environment to those that are involved. And we also need to make sure we immediately report to the supervisor and administrator. Residents have the right to voice concerns. Residents have the right to be heard. All concerns, questions, complaints must be heard and listened to. So, who do you go to if you learn of a complaint? You're going to want to go to your supervisor and/or your administrator. Check with your supervisor regarding facility complaint procedures. The avoidance of complaints. Most complaints can be avoided with just good patient care and good customer service. State and federal agencies, residents do have the right to contact them. They can, if they have issues regarding Medicaid or Medicare fraud, there's agencies for that. There's the Ombudsman Agency, their Division of Quality Assurance. There's also required postings that the facility must have up in the locations, so please check with your supervisor as to where these required postings are kept. Residents also have the right to voice concerns without any fear of reprisal. In the previous slide, I had mentioned that a resident has the right to consult with an ombudsman, but what just is an ombudsman? It is a person, an advocate for our residents. Each county in our state has a regional ombudsman. Most frequently expressed concerns are about substandard care, complaints about access to providers or services of choice, providers not treating consumers with dignity and with respect. And how to contact an ombudsman is a requirement on our end that we must have posted where all residents can readily see this information. Again, make sure that you check with your supervisor as to where these required postings are kept in your building. So in summary, caregiver misconduct violations are prohibited. They constitute a crime. They may result in the loss of professional licenses or nursing assistant certification. All we need to have is reasonable cause to believe that something occurred or just a suspicion, and you must immediately report. You must know the facility's policy for abuse prevention. You need to understand your role as it contributes to abuse prevention. You need to respond if you see, if you hear, or have knowledge to believe that a resident is being hurt, neglected, exploited, or misappropriated. Again, you need to stop the abuse from happening. You need to protect the resident, keep them safe, and you need to report immediately to the administrator or to the administrator's designee. Now for a quiz. Resident rights. This concludes the presentation on resident rights. You will be directed to complete a resident rights quiz. Again, if you have any questions regarding residents' rights, please refer to your supervisor or contact your facility social worker or administrator. Thank you.